Thank you for the community who's joined us this evening on this webinar. Really appreciate the opportunity to have this dialogue with you in terms of Center for Community Health. Before we begin, though, I would be remiss. And first of all, a quick introduction about myself. I've been here about 1.5 years, and Alan Lee, who is our Chief Operating Officer, who you'll meet shortly this evening as well, has been here for about 1.5 years as well. Both of us come from a long background with New York-Presbyterian. I've actually been with the hospital in a variety of roles for just about 15 years now. So it's been a really great opportunity and very much honored to take on this role in terms of working with the community, working with the clinicians, working with the staff here in terms of the journey that is New York-Presbyterian, Brooklyn Methodist. Before we begin, though, I'd be really remiss without saying enormous thank you to the community for the incredible support that we felt here as we moved through our COVID crisis, as it were. It's sort of remarkable to think about, but yesterday, March 8th, we actually saw our first positive COVID patient here at Brooklyn Methodist. It is just remarkable to think that by mid-April, we had nearly 400 COVID positive patients here at the hospital. And of those, nearly 130 required ventilators or other specialized intensive care. So it was quite the journey. And as I hear the narrative of our staff talk about their feelings, their experience, and we are still going through COVID, and if there is time, we can certainly give an update on that towards the end of the evening. But as I hear our staff talk about their narrative of their experience in terms of dealing with COVID and the many, many issues attendant upon that, honestly, one of the top things that always comes up is the recognition of the support we got from the community, whether that was the clapping each night at 7 o'clock, whether that was the food, whether that was signs put up around the hospital, around the community. So I do want to thank everyone for that, because I want to tell you on behalf of our staff, it made a huge difference and made a tremendous impact on them. So again, enormous thank you for that. So I know we're going to do a presentation on CCH, and Alan Lee will lead that. And then, as Lauren said, we will certainly open up for questions and answers. And I know we have a robust set of questions already. So Lauren, I will turn it back to you if that works.
Great, thank you so much, Rob. And then we also have Jared Brilliant joining us from Preserve Park Slope, and he was just going to say a few words at the open. So I'll turn it over to Jared.
Okay, thank you, Lauren. Appreciate that. And thank you, everyone at New York-Presbyterian. We certainly appreciate having you here in our community during these trying times. And congratulations on the opening of your new facility. It looks very nice. I hope things are going smoothly with the opening. Just want to refresh a little bit. Prior to the construction, Preserve Park Slope and Brooklyn Methodist entered into an agreement that had a few stipulations, but generally that we would be partners working together to have a dialogue, that we remain open. Shortly after our agreement, Brooklyn Methodist entered the Presbyterian family. And in the interim, we've had great cooperation working on the traffic task force that was set up through Brad Lander's office, through the construction I forgot the precise name. Task force. Construction task force that involves CB6 and DOT and all the contractors of the hospital. And I just want to thank all the people from Preserve Park Slope and the community who participated in those. I would name you by name, but I don't know who wants to be named by name and who doesn't. But over the years, it's been a good partnership. There's been a good open dialogue. The hospital has been very responsive to community concerns and questions. Also, as part of our agreement, Preserve Park Slope requested that the hospital be available to have leadership available to us at least once a year. And we've met over the course of the years several times. And again, we really appreciate your partnership in having a dialogue. So likewise, we thought that with the opening, it was a good time maybe to get an update, because talking to my neighbors, we weren't all that clear on some things. So we suggested it to Lauren, and she was kind enough to put together this panel. And again, thank you to the panel for making yourselves available for questions this evening. And yeah, I guess that's all I have to say. So I'll toss it back to you, Lauren.
Thank you so much, Jared. Thank you to you. And in particular, I just want to give a shout out to Lori Chaumont, who we've been working closely with to put this on. And she's also on the Construction Task Force and Traffic Committee. And Marvin Saporin also sits on that. There's a number of you who I see on in the participants window. So thank you to all of you who've been, steadfast members of those task forces and have been with us throughout and have kept us on our toes and always let us know when you have a concern. And, we're happy to keep the dialogue open. And we're going to give you a little bit more information about what's inside the Center for Community Health. And then we'll open it up to the questions after the presentation. So with that, I'm going to turn it over to our Chief Operating Officer, Mr. Alan Lee.
Thank you, Lauren, and good evening to all of you. Thank you for spending some time with us this evening. For Rob Gemento and myself and the rest of our team, it's certainly an honor to be able to engage in the dialogue with this constituency as representatives of the greater communities that we serve. I will be doing a presentation on CCH in just a brief moment. As Rob said, both of us have actually been with New York Presbyterian. In my case, just shy of 12 years. I started at the Weill Cornell campus as a vice president there before going up to the Columbia campuses as vice president of operations, and before coming here 2.5 years ago, as Rob indicated, as chief operating officer. And it's been an absolutely remarkable journey. I'm sure I'm not saying anything to all of you that you don't know, but there's something so incredibly special about the community that Brooklyn creates, and Brooklynites, I should say, really figure out how to create community that we don't quite see with this robustness anywhere else in New York City. So we're honored to be here and frankly delighted to be able to give you an update on the project itself, and other team members will also be able to take questions and answers.
Thank you, Alan. And also, would you just also introduce David, who's on the call, and then we'll bring up the slides.
I certainly will. So my good colleague, David Farron, who you're seeing animate there via wave. David is our corporate director of facilities construction and design. David, by trade and training, is an architect and has been really the brain trust behind the great project for us. David has had an extraordinary career, including doing some very similar work at NYU before joining us here at NYP to have his first major construction project be CCH. So we are incredibly fortunate to have David joining.
Welcome, everybody, and it's been a pleasure working with you these past 3.5 years. The teamships that we created really made this an excellent project, and we hope you enjoy it as much as we're going to enjoy it. And welcome.
Thank you, David, and thank you, Alan. And with that, take it away, Alan.
Will do, Lauren, thank you. And I'm going to initially thank Danny, who is going to help me to advance these slides. Danny, you can go right ahead into the very next one. So we'll give you a little bit of a sense of timing, if you will. This has been an absolute labor of love that is about 8 years in the making, although our groundbreaking did officially begin in the autumn of 2016. And then in the autumn of last year, we got our temporary certificate of occupancy. DOH survey occurred also in the autumn in November. And then our staff trial runs, where we started to really test some of the systems in the building, happened toward the end of last year into the beginning of 2021. In all clarity, we did softly open on January 25th with some of our services, including our cancer practices, our Infusion Center, and our clinical trials office, along with the pharmacy and lab. all on the 6th floor, and you'll hear a little bit more about that. And our pre-anesthesia evaluation center did open on January 25th as well. So we are preparing for what will be our full opening next Monday, in a few short days from now, where all of the balance of services will go in, and I'll speak further about what will be on each floor. Next slide, Danny. So as you think about the building itself, and this visual gives you a good sense of the 6 floors that will occupy, along with the concourse level, which is below ground grade. On the concourse, we'll have 6 procedure rooms for outpatient endoscopy and special procedures, including gastroenterology practices. And then on the ground floor, which is where our main entrance is, right off the garage is the main lobby. We have a retail cafe, which we refer to as the Brownstone Cafe, in homage to really the wonderful community of Park Slope. And our conference center is located there on the ground floor as well. The first floor, we have our diagnostic imaging, pre-anesthesia evaluation center. And then on the 2nd floor, our prep and recovery for ambulatory surgery, multi-specialty medical practices. And then on the 3rd floor, we have 12 operating rooms and for our ambulatory surgery settings. At least one of those will be dedicated for ocular procedures. We are really excited to introduce an IOR for our eye procedures at CCH. On the 4th floor, our multi-specialty surgical practices, including our clinical trials office and central sterile and materials management, will be located there. And as I indicated earlier, on the 6th floor, our ambulatory infusion center with a dedicated pharmacy and lab, our oncology practices are all on the 6th floor. We are leaving the 5th floor for right now as shell space, and likely that will be the home of our women's center in what we will refer to as the Day 2 project, at least a year and a half to 2 years from now. Next slide, Danny. So this is the newest ambulatory care center in Brooklyn. We are particularly proud because it's the first major construction of this type in over 40 years in Brooklyn. We will have operating hours that will be primarily Mondays through Fridays, with some Saturday offerings that will start as early as a little after 7 in the morning, with all procedures ending certainly by 5 to make sure that we can get all patients out of the building by 6 p.m. Every day. Some of the services will be a little bit more limited, as I indicated, on Saturdays. Those will include such services as Infusion Center and certainly our imaging services, and a few of the others like pre-anesthesia evaluation center. It is important that everything in this building should be reflective of our commitments that we've made to the community itself. And hopefully you'll see that in some of the visual that we'll share with you in terms of both interior and exterior of the building. But really it's a commitment to better serve this community and provide access to comprehensive high-quality healthcare in one convenient location right here. We say that because we have studied an extraordinary journey of out-migration of Brooklynites who choose to go into Manhattan for their care. Our belief is that we can deliver world-class care to the great borough of Brooklyn right here in our own backyard. We know that there is active community involvement and engagement, quite frankly, through all phases of the development. And you heard Jarrett certainly speak about some of that. We have designed this space to really not just blend in, but complement the beautiful Park Slope community. Our artwork that you will see throughout the building has been very carefully selected. The hospital president, Rob Gimento, who you heard from, assembled a group of us over quite a number of weeks in his office as we went through an extraordinary offering to select the palette of artwork throughout the building that we ended up with. As such, we have committed to having a very diverse slate of artists, and many of those are Brooklyn-based, and I'll speak a bit further to that. One of the other offerings that I think is really important and part of the commitment we were making to the community is offering our conference center, which will also be available for community-based organizations. Next slide, Danny. So as we really focus on the patient experience itself, and I think access has to be a key part of that focus. But also you'll hear me speak about some of the technologies that are being introduced, and certainly many of the amenities and service offerings that are being introduced in the building. Right as one walks in, you'll be warmly greeted by an access service rep to help the patient and their family member or whoever is joining them to get registered, and we will make sure that the access service reps are appropriately screening in the COVID world that we all now live in. We have hand sanitizing stations in the lobby, but certainly throughout the building. But the access service reps will really be critical for helping to acclimate all of our patients through their continuum of care in the building. We offer valet parking services. I'll speak a bit further about the garage offerings later, but all of it will be valet parking. And as such, we've taken a lot of great precautions and protocols to ensure safety for our patients and their family members who are driving in. Our online access is available, and we will really encourage patients to register online. They could do it on a smartphone or any device so that they are able to get scheduled and registered prior to their arrival. Within the center in the Infusion Center, there are unique bays designated, not the Infusion Center, pre and post surgery. We have unique bays designated for each patient for their surgical prep and recovery. And diagnostic imaging is something that we're particularly very, very proud of. We are, for the first time, introducing the PET-CT capability here at Brooklyn Methodist, and it'll be housed at the Center for Community Health, as well as an MRI and multiple other modalities for imaging services. Next slide, Danny. Our cancer center, as I've spoken a bit about, will offer comprehensive service offerings. We'll have access nurses and a navigator, social workers, financial counselors, dietitians, and all of the things that are key elements to having comprehensive cancer care. We are very proud to say we have on-site infusion so that our drugs can be mixed right there at the center. And our joint clinical trials office, which will be absolutely game-changing for us. Multidisciplinary clinics to support the care that these patients receive. And another element that is extremely unique in this region, and certainly the only one of its type in our entire system of NYP, is our same-day access program in the Cancer Center. That program is for patients that may be receiving care and are not feeling optimal quite yet to go home after their care, or maybe at home and not feeling really well. Instead of having them come into the emergency department to be treated, they can actually come right up to the 6th floor to the same-day access center. It will be staffed by nurse practitioners and registered nurses who are familiar to the patient and certainly can appropriately care for the patients in that setting. Next slide, Danny. Thank you. So in the cancer center, sorry, next slide, Danny. In the building, we'll have a theme throughout, which is co-located complementary services. As such, we'll have ambulatory surgery, we'll have cardiology along with echocardiography, we'll have orthopedics with x-ray, and we will have GI and endoscopy suites with metabolic weight management, with bariatrics and endocrinology. Next slide, Danny. So right upon the entrance here, this is the arrival for those who are walking into the building, but also for those that are driving in for our valet parking. And to the left is that feature wall that I spoke briefly about that I find incredibly aesthetically appealing. And the theme behind that wall was really to capture the nuances of color of Park Slope itself. So in that valet parking, we'll have about 315 slots, which we did quite intentionally, that go down into the ground for several levels. The valet parking will be for all of our patients and families that are driving in. The goal is that we will be able to offset some of the patients that currently are parking in our 6th Street garage and have them park in the valet parking setting here at CCH. And ultimately to make sure that we are decanting what is upsetting us, and I'm sure all of you, which is the extraordinary traffic that's going on right now. I won't belabor it, but what I will say is that I'll speak in a little bit about some of the steps that we have taken to diminish some of the inappropriate and illegal parking that we're seeing on 6th Street now. This garage, we believe, will be extremely helpful to get much of that off of the street and also to clear up ease of flow. Next slide, Danny. I'll go through these visuals fairly quickly, although I do think it's important to share them with you. Right in the lobby, you'll notice the photo to the left is really our registration and arrival desk, and the first piece of artwork that you'll find greeting you is done by Kehinde Wiley. Kehinde Wiley, as many of you are probably aware, was commissioned to do the Obama portrait while former President Barack Obama was in the White House. And Kehinde Wiley is Brooklyn-based, and we are very fortunate to showcase this piece, which we believe is an incredibly welcoming image. And you do have a photo there on the right of one of our conference spaces of 3 primary conference rooms that we have that will be used for meetings and also community events, certainly when it's safer in our COVID world. Next slide, Danny. This is a picture of our sky lobby. There are actually sky lobbies on each floor. Throughout the building, there is extraordinary access to natural lighting, which really just changes sort of the mood and tenor of the building itself. There is an infusion, as I said, of the natural lighting, and the goal of this, which you don't see in this particular picture, but next to each of the sky lobbies, there are sort of respite areas or waiting areas. Our goal is that our patients shouldn't be waiting very long for anything in this ambulatory setting, but to make sure that it's an extraordinary experience and that they're navigating well throughout. Next slide, Danny. As I indicated, our diagnostic imaging suite of services will be just extraordinary. We have both MRI and the PET-CT. The MRI suite, which you see on the left, is just extraordinary. Those who Mr. Gimento and I have been able to tour through the building constantly use the same language. People say it's very spa-like. It's infused with lighting, and patients can actually choose the tone and colors of lighting that they want, as well as underscoring music with it that is, as we say, very zen or very spa-like, particularly calming for those that might have phobias of enclosed areas like an MRI. And then we're extraordinarily excited and proud to present the PET-CT to the right. Next slide, Danny. Our Infusion Center, just a couple of images of that. Each are dedicated with bays, as you'll see, and our patients in any of their settings, these chairs actually do turn into exam tables, quite frankly, and the other space that I spoke about earlier, this access center here gives us actually 3 beds for those patients that might be feeling not quite well enough to go home, as I said earlier, or that may need to come in and be cared for by the nurse practitioners and the RNs there. Next slide. This is a picture of our state-of-the-art operating arena, if you will. The ORs, there are 12 of them, and our surgeons could not be more delighted. They are spacious. We have Karl Storr's technology in these, and that's really great for radio broadcasting, for teaching purposes, that frankly, in other settings at NYP and as well as around the world, our surgeons would be able to do learning and teaching programs through these ORs. We have recessed cabinetry, which you'll see back there, which from an infection prevention and control perspective is so much safer safer, and so many things have been thought about in this setting, including the walls, which you'll see with brushed stainless steel from a cleaning perspective is just so much better for our teams in the OR. So the surgeons and all of our OR teams are really excited about the operating rooms. Next slide. Here you get just a very, very, very small sampling of some of the artwork through the building. Again, the art will take on a life of its own, and we will have QR codes under all of the artwork displayed throughout the building so that you get to learn a bit more about the artist as well as the artist's intent behind the design of each piece. There will be, even in each exam room, a different piece of art, as well as large ones in the public and common areas. Featured here, the one that we spoke about, Kehinde Wiley, is right in the lobby. You'll also see some beautiful pieces by Shanique Smith. And then there's Sephora Fried, who is an Israeli artist who also does have a Brooklyn base here, and Leonardo Drew. Shanique, Sephora, and Leonardo are all Brooklyn based. Some absolutely magnificent pieces. The Sephora Fried works you'll find on each of the elevator landings, slightly different than this, but using pencil, and just extraordinary fine work that this does not truly capture the detail of. But we believe that it's just going to be an extraordinarily calming and healing environment where art enhances the experience. Next slide, Danny. So we, as I spoke about, we are introducing a QR code that will help people get to learn more about the center itself and about the palette of art through the building. And it will really allow us to engage our patients and their families. Imagine that a family who comes in with someone who's having outpatient surgery, that person will have access to the bay that I spoke about throughout the time so that we can easily find the family member and update the family member on progress for their loved one. But we will also be banding all of our patients and their visitors, which allows us to know where the patient is within the building at all times and where their family is at all times so that we can have ease of finding that person and also getting the patient to the next level of care. We are extraordinarily excited about this project. Next slide, Danny. So if you think about the journey that we've been on from our 2013, the hospital shared preliminary plans at the community meetings for our outpatient facility to bring us to what we are about to introduce fully as of next Monday. It has been an incredible journey, which could never have happened successfully without a tremendous amount of confidence, ultimately, from our community constituents and your decision to allow us to really move forward with this extraordinary project, which we think will honor Brooklyn and the wonderful citizens of Brooklyn.